Guys, welcome to Prasu'S Medledge. I hope you all are doing good and have watched my previous videos. If not, what are you waiting for? Go for those after the end of this video. Now without wasting any time further, let's get into today's topic. So today I'm going to discuss with you metabolic syndrome, which is quite an important topic in medicine and can be asked as a short note in the university exams. Okay, so metabolic syndrome was previously known as syndrome X or insulin resistance syndrome. It refers to the clustering of risk factors for cardiovascular disease and type 2 diabetes mellitus. That is, it includes basically abdominal obesity, hyperglycemia, dyslipidemia, that is high triglyceride levels and low high density lipoprotein levels. And along with that, there is elevated BP, that is hypertension. So if we identify individuals with metabolic syndrome, we should start lifestyle modifications in them to correct the above mentioned abnormalities and hence prevent the development of cardiovascular diseases and type 2 diabetes mellitus in these individuals. Now coming to the pathology of metabolic syndrome, so the defect in this is insulin resistance. As I have already mentioned, it is also known as insulin resistance syndrome. So the defect is insulin resistance, that is defined as inability of insulin to produce its actions in spite of unimpaired secretion from the beta cells of the pancreas. Along with this, adipose tissue is also considered central in the pathogenesis of complications associated with metabolic syndrome. It releases pro-inflammatory mediators, that is interleukin 6 and tumor necrosis factor alpha, as well as pro-thrombotic factors, which finally leads to accelerated atherosclerosis. Okay, so this was about the pathology. Now coming to the clinical diagnosis of metabolic syndrome. For diagnosis of metabolic syndrome, presence of at least 3 of the following should be there. Okay, so what are these? First is abdominal obesity, that is waist circumference more than 80 cm in females and more than 90 cm in males. Elevated triglyceride levels, that is more than equal to 150 mg per deciliter. Reduced high density lipoprotein levels, that is less than 40 mg per deciliter in males and less than 50 mg per deciliter in females. Next is elevated blood pressure, that is either systolic blood pressure more than equal to 130 mmHg or diastolic blood pressure more than equal to 85 mmHg. Then elevated fasting plasma glucose levels, that is more than equal to 100 mg per deciliter. So any 3 of these should be present to diagnose metabolic syndrome. Now coming to the diseases which can occur if metabolic syndrome is not managed properly with proper lifestyle changes. So these are, as you know already, cardiovascular diseases and type 2 diabetes mellitus. These are the most important. Apart from that, we can also have polycystic ovary syndrome, non-alcoholic fatty liver disease, chronic kidney disease, and sleep disorder breathing. So what is sleep disorder breathing? It is basically a group of conditions which is characterized by an abnormal respiratory pattern during sleep. So these are the diseases which can occur if we are not properly managing metabolic syndrome with the lifestyle changes and the drugs. Now coming to the management. So the treatment of insulin resistance involves basically lifestyle changes, which I have already mentioned. So the components of lifestyle changes includes exercise, hypocaloric diet, that is diet which is low in calories, then weight reduction, diet high in fibers. Okay, so these are the lifestyle changes. Along with these lifestyle changes, we had to do control of hyperglycemia, that is we had to control diabetes mellitus, then we had to control hypertension and lipid abnormalities by various drugs. So this was about the management of metabolic syndrome. Now let's revise metabolic syndrome once again. So metabolic syndrome is basically a clustering of risk factors for cardiovascular disease and type 2 diabetes mellitus, that is it includes abdominal obesity, hyperglycemia, dyslipidemia, that is low high density lipoprotein levels and high triglyceride levels and elevated blood pressure. It was earlier known as syndrome X or insulin resistance syndrome. And in metabolic syndrome, if we are doing proper lifestyle modifications, then we can prevent cardiovascular diseases and type 2 diabetes mellitus in these individuals. Coming to the pathogenesis, the main point is insulin resistance, and along with that, adipose tissue releases pro-inflammatory mediators and pro-thrombotic mediators, which leads to accelerated atherosclerosis. So these are the 2 important points in the pathology of metabolic syndrome. And coming to the clinical diagnosis, that is 3 out of the 5 should be present. So that is abdominal obesity, which I have already mentioned, more than 80 cm in females, more than 90 cm in males. That is this more than 80 cm and more than 90 cm is nothing but the waist circumference. Next is elevated triglyceride levels, reduced high density lipoprotein levels, elevated blood pressure, elevated fasting plasma glucose levels. Remember the values. The diseases which can occur if we are not managing metabolic syndrome properly includes cardiovascular diseases, type 2 diabetes mellitus, non-alcoholic fatty liver disease, then polycystic ovary syndrome, sleep disorder, breathing, and chronic kidney diseases. And management basically includes lifestyle changes, that is we have to do exercise, hypocaloric diet should be taken, weight reduction should be done, then we should take diet which is high in fibers, and along with that we have to manage hyperglycemia, lipid abnormalities, and hypertension with various drugs which are required for that. That is the drugs which helps in controlling hyperglycemia, hypertension, and lipid abnormalities. So that's it, guys. So guys, if you like my content, please do like, share, subscribe, comment, and also press the bell icon so that you get notified whenever I upload a new video. Thank you.